The suspension of most funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to services for HIV treatment, testing, and prevention in more than 50 countries. 8 countries now have substantial disruptions to antiretroviral therapy and will run out of medicines in the coming months. Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year. The US administration has been extremely generous over many years. And of course, it's within its rights to decide what it supports and to what extent. But the US also has a responsibility to ensure that if it withdraws direct funding for countries, it's done in an orderly and humane way that allows them to find alternative sources of funding. We ask the US to reconsider its support for global health, which not only saves lives around the world, it also makes the US safer by preventing outbreaks from spreading internationally. If the US decides not to restore direct funding to countries, we ask it to engage in dialogue with affected countries so plans can be made to transition from reliance on US funding to more sustainable solutions without disruptions that cost lives. The sudden cuts to US funding are also affecting efforts to eradicate polio, to monitor the emergence of diseases such as avian influenza, and to respond to disease outbreaks and humanitarian crises. Almost 24 million people living in such crises are at risk of not being able to access essential health services. More than 2,600 health facilities in 12 humanitarian crises have already suspended services, at least partially, or will do very soon. In many countries, the abrupt loss of US funding threatens to reverse progress in disease control, immunization rates, maternal and child health, and emergency preparedness. In Cox's Bazar in Bangladesh, the largest refugee camp in the world, diagnosis and treatment of hepatitis C has been disrupted, as well as disease surveillance, primary and secondary health care, laboratory services, procurement of supplies, and salaries of health workers. There are now severe disruptions to the supply of malaria diagnostics, medicines, and insecticide-treated bed nets due to stock-outs, delayed delivery, or lack of funding. Over the last 2 decades, the US has been the largest bilateral donor to the fight against malaria, helping to prevent an estimated 2.2 billion cases and 12.7 million deaths. If disruptions continue, we could see an additional 15 million cases of malaria and 107,000 deaths this year alone, reversing 15 years of progress. On tuberculosis, 27 countries in Africa and Asia are facing crippling breakdowns in their response, with shortages of human resources, disruptions to diagnosis and treatment, data and surveillance systems collapsing, and vital community engagement work deteriorating. 9 countries have reported failing procurement and supply chains for TB drugs, jeopardizing the lives of people with TB. Over the past 2 decades, US support for TB services has helped to save almost 80 million lives. Those gains, too, are at risk.